1 month before a heart attack, your body will alert you. Here are 8 symptoms. Recently, a heart attack has become the #1 cause of death in the world. This is not strange at all. We all live a stressed and fast-paced life, and we eat all the junk food around us. Thus, this should not come as a surprise. Due to the fact that heart attacks are very common, today we are going to teach you how to recognize the symptoms of a heart attack. Please subscribe, click the bell and watch this video until the end to know the complete information. If you pay more attention to your lifestyle and just change the old unhealthy one with the healthy one, this will decrease your stress levels and reduce the symptoms of heart failure. Did you know that the symptoms of a heart attack can be noticed even a month before the heart will experience failure? Here are the 8 symptoms of heart attack. 1. Fatigue. If you are feeling tired after a good night's sleep and this does not go away, it might mean that you have a loss of blood flow to your heart. 2. Chest pressure. People might ignore chest pressure due to the fact that they think that it is normal or not something alarming. But it is. Chest pressure is the most common symptom of a heart attack. Therefore, the next time you feel it, consult your doctor. 3. Cold sweats and dizziness. What can cause cold sweats and dizziness is poor circulation, which affects the proper blood flow to the brain. This is very important for the operating of the brain, thus resulting in these symptoms. 4. Cold and flu symptoms. Many people experience cold and flu symptoms right before they have a heart attack. Therefore, if they are consistent after a while, you have to consult your doctor because you might be in danger of a heart attack. 5. Weakness. Another sign of an impending heart attack is weakness. When the arteries become narrow, then they do not let the blood circulate properly. This means that the muscles are not getting everything they need, thus resulting in falling. Therefore, you should be very careful if you experience some weakness. The best thing here would be to consult a doctor. 6. Shortness of breath. On the off chance that your lungs don't get the oxygen they require, the heart will likewise not get the blood it needs. This means these 2 frameworks are associated, and in the event that one of them doesn't work, the other won't also. In this manner, on the off chance that you are having a few issues with breathing, you ought to quickly visit the specialist, since it may imply that a heart assault is coming. 7. Pain in the chest. Chest pains occur in both men and women. Men should not ignore this symptom because it indicates a heart attack. About 30% of women are affected. This type of pain can happen in both hands, but especially the left one, the lower jaw, neck, shoulder, even in the abdomen. It may be short or long. 8. Arrhythmia. Arrhythmia means missed heartbeat, and it is followed by panic attacks and anxiety. Usually, it happens among women. It occurs unpredictably, and it may be irregular heartbeat, or increased heart rate. Your heart rate may be increased by physical training as well, especially in cases with atherosclerosis condition. This irregularity of the heartbeat stays for a minute or 2. If it lasts longer, you may experience dizziness as well as extreme fatigue, and you need to immediately call your doctor. What are the risk factors? As you know, smoking, lack of physical activity and obesity are most common risk factors. However, there are several factors that people do not usually notice, but they are important in maintaining your health and avoiding a heart attack. Men may experience hair growth in the ear canal. When walking, you experience light tenderness in the calf muscles. The inner corner of your eye has yellow patches. An earlobe crease. If you experience these symptoms, doctors say that you need to be checked immediately. Normally, people over 40 are at a higher risk of having a heart attack than a younger person. So be aware of these signs. These are every one of the indications that you have to keep an eye out for if there is a heart assault in transit. When you remember them, ensure you treat them promptly. In this manner, be watchful and ensure you keep your cardiovascular well-being in a good condition.
2 diabetes is a metabolic disorder that causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination and excessive thirst. Other symptoms include weakness, drowsiness, and blurred vision. These are caused by chemical imbalances in the blood related to high levels of blood glucose. About 1 in 4 people with type 2 diabetes are unaware that they have the disease. It is important to catch diabetes early. Over time, high blood glucose damages the blood vessels, which can damage the organs that these vessels supply, leading to a variety of health complications. Damage to the small or micro blood vessels can cause vision problems, including loss of sight, nerve damage, and kidney disease. Damage to larger or macro blood vessels can lead to cardiovascular complications such as heart disease, stroke, and poor blood circulation. Overweight and inactivity are major causes of diabetes. A family history of diabetes significantly increases your risk of developing the disease. Certain ethnic populations are also at increased risk of developing type 2 diabetes. Finally, some medications may increase your diabetes risk, specifically corticosteroids, thiazide diuretics, drugs used to treat certain mental illnesses, and some antiretrovirals used to treat HIV infection. In summary, type 2 diabetes is a metabolic disorder. It causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel for the cells in our body. If not diagnosed and treated in a timely manner, type 2 diabetes can lead to many health complications.
Your Insti-HIV self-test is simple to perform and very accurate. The test device will determine your result. The control dot and/or test dot will appear at the end of the test. Remember, your Insti-HIV self-test will only work once. Once you have performed the test, it cannot be reused. Results should be read immediately. Before you start, read and follow the instructions carefully. Make sure that the testing area is clean and bright. Inside your self-testing kit, you will find the instructions, the test device pouch, bottles 1, 2 and 3, and lancet. When you're ready to start, open the test device pouch. Place the test device on a flat surface. Bottle 1. Remove the cap and place the bottle on a flat surface. Place the cap nearby to recap the bottle after you add the blood. Twist and pull the blue tip out of the lancet and place aside. Rub your finger until warm. Place the lancet on the side of fingertip. Press hard until you hear a click. Rub the finger to get a larger round drop of blood. Let one drop fall into bottle 1. Twist on cap of bottle 1. Apply a bandage. Bottle 1. Shake bottle 4 times and pour all of the liquid into the test device. Wait until the liquid disappears. Bottle 2. Shake bottle 4 times and pour all of the liquid into the test device. You may need to gently tap bottle 2 to get the liquid out. Wait until the liquid disappears. Bottle 3. Shake bottle 4 times and pour all of the liquid into the test device. Wait until the liquid disappears. If your result is negative, test again in 3 months. If your result is positive, go to a clinic to see a doctor. If your result is invalid, your test did not work. Go to a clinic to see a doctor. Put all of the items back into the big pouch. Throw away the pouch into the waste bin.